Hello, Uganda. This is Muwanguzi Shadrack, head doctor from Mengo Hospital. I'm here with good news. We are going to be talking about something very important, and that is hypertension, also commonly called high blood pressure. These days, we have a challenge and a shift in the nature of illnesses affecting our people. Back then, it used to be what we call communicable diseases or infectious diseases, the kind of illnesses that you will get from another person directly. Now we have a trend and we are shifting towards what we call the non-communicable diseases. Those are illnesses which you will not acquire directly from someone. Illnesses like diabetes mellitus, high blood pressure, also called hypertension, and many others are non-communicable, as opposed to illnesses like malaria, HIV, TB, and the others in that category, which are communicable or which can be transmitted from one person to another. There are many reasons as to why we are having such a trend, but majorly the lifestyles and the new trends as a result of modernization that people are taking up have caused many people these days to suffer from such illnesses. Today I'm going to be talking about hypertension or high blood pressure, and there is a lot that we are going to be talking about. One would wonder, why high blood pressure this time around? Worldwide, there are over 1.28 billion people between the ages of 30 and 79 who live with high blood pressure or hypertension. And that's quite a big number. But out of this number, the biggest proportion are people in the low and middle income countries, Uganda inclusive. 2/3 of these 1.28 billion people are found in our low and middle income countries. And the unfortunate bit is most of the people that live with these illnesses actually don't even know. They don't get to know until maybe they've got severe complications, or until later on in life that they get to find out that they had such illnesses like high blood pressure. So today we are going to be talking about this high blood pressure, because even here in Uganda, if you went out to the market, to the streets, or any other place that gathers people here in Uganda, and you started measuring people's blood pressures, you'd find that out of 100 people, almost 30 of them are having high blood pressures. That's a very big number. Out of 100, 30 people having their blood pressures quite elevated. And yet, if you went ahead to find out how many of these people have been knowing that their blood pressures were actually high, you'll be disappointed, or you will get to find out that majority of them were having high blood pressure but not knowing. For example, if you went out and you started measuring people's blood pressures, and you then keep isolating those whose blood pressures you find high, and you collect 100 of them, then you start asking one by one whether they actually knew that their blood pressures were high. You will only find 8 out of 100 people with high blood pressures that will be knowing that, oh, I actually knew my blood pressure was high. And out of these 8, if you went ahead to find out how many of them are doing something about it, or you will even get surprised that less than half will be doing something appropriate to ensure that their blood pressures are actually controlled. That's why it's very important for us to keep sharing such messages, because we believe through this kind of knowledge, once you practice some of the things we are going to be talking about, you can ably prevent, you can control that blood pressure even though you have been diagnosed with high blood pressure or hypertension. The other challenge with such illnesses like high blood pressure, someone can have it markedly elevated, but they don't get to know, they don't feel any symptoms, they don't feel anything unique. Or even when they feel anything unique, it's not so severe. Because if someone has something that causes maybe a lot of pain, they will not settle until the pain has been sorted. If maybe someone gets something that causes a lot of stomach or abdominal pain, headache or joint pain, and it is so severe that they can't bear it, they will find all ways of ensuring such symptoms have been attended to. But now the challenge with such illnesses, you can have it and don't feel anything, or you feel something but it's not so severe, and so there is really no pressing need for you to go to a health facility or to go to any health worker for medical consultation. And yet these illnesses have the ability to keep damaging your body progressively. It's not so sudden, but progressively they keep damaging essential parts of your body, essential organs within your body. And later on in life, you might get full-blown complications, which might be really hard to treat, or may not be treatable, or may actually result into death. That's why it's very important for every one of us to get to know such things, so that we can ably prevent where necessary, or prevent the complications for those that already have the illness. So today it's high blood pressure or hypertension. What exactly are we going to be talking about? One, we are going to be defining in simple language but exhaustively to help you understand what exactly high blood pressure is. We shall understand in the first place what blood pressure is. Then we shall talk about the things that increase your risk of getting high blood pressure or hypertension. We shall talk about the things you feel in your body once you have hypertension, the things that you are supposed to do to prevent hypertension, then the things a person that has hypertension is supposed to do to ensure that their blood pressure is brought back under normal range. And then we shall also talk about the complications, the severe damages that you're likely to get in case you have high blood pressure, but you don't either get to find out, or you find out but don't do anything about it. That is not to scare you, but to emphasize why it's important for every one of us to actually pay attention to this. And then we shall also have room for questions, inquiries on all our social media platforms, but you could also visit the hospital. Our wellness clinic is operating from Monday to Friday, and you can always come around, because sometimes people feel, I don't have to go to hospital and mix up with a lot of patients, people who are suffering from different illnesses, because for me, generally, I actually feel well. Yeah, there is room for you as well, who may feel as though you are not sick. You're just coming for checkups, BP measurement, or wellness checkups. We have a clinic running every day from 8 a.m. to 5 p.m. from Monday to Friday at Mengo Hospital.